Chronic fatigue syndrome, or CFS, can make everyday life feel incredibly hard. It's not just feeling tired. It's a deep, ongoing exhaustion that doesn't go away with rest, and it can seriously limit your ability to live a normal life. Now, scientists have looked closely at one therapy that has often been suggested for people with CFS, cognitive behavioral therapy, or CBT for short. A group of researchers recently reviewed 15 high-quality studies involving over 2,000 people with CFS. Their goal? To find out if CBT really works, and whether people are actually willing to stick with it. So what did they find? First, let's talk about effectiveness. People who received CBT reported less fatigue, felt less depressed or anxious, and had a better sense of overall health after the treatment. These effects were especially clear right after therapy, and in some cases, even lasted for months. In simple terms, many people felt better, not cured, but better able to handle life, their emotions, and their symptoms. Now, some people worry that CBT is just about thinking positively or pretending everything is okay. That's not true. CBT helps people recognize unhelpful thought patterns, like, "I'll never feel better," or, "If I move too much, I'll crash completely." These thoughts might feel true, but they can also keep people stuck. CBT gently challenges these thoughts and teaches new ways of thinking and acting. For example, people learn how to slowly build up activity in a way that feels manageable, not overwhelming. They also get tools for handling tough emotions like fear, guilt, or sadness. It's not easy, but it can be really empowering. So, CBT works for many, but what about acceptance? Are people with CFS actually willing to try it? Surprisingly, yes. Across all the studies, only about 7% refused treatment, and most people who started CBT completed most or all of the sessions. That's a good sign that the therapy is not only helpful, but also acceptable to patients. Of course, CBT doesn't help everyone. The research showed that people who had more severe fatigue were slightly more likely to stop treatment early. And not all studies looked at long-term effects. Still, the fact that people improved and stayed with the therapy shows that CBT is a solid option. What does this mean for someone living with CFS? It means there's hope. CBT isn't a cure, and it won't remove every symptom. But it can give you tools to manage your energy, cope with the emotional weight of chronic illness, and feel a little more in control. For some, therapy might start online. For others, it might involve working one-on-one with a therapist. But the core idea stays the same. By understanding how your thoughts and behaviors interact with your illness, you can begin to make small, meaningful changes. And maybe, over time, those small changes can lead to a better quality of life.